Hi everybody, it's Dr. Blake from Kelstein Chiropractic, your Baltimore area chiropractor, and we're going to show you the best chiropractic and soft tissue techniques for jaw pain. We've got Anna in the office. Anna is rocking her Thursday Ravens gear, as you guys can see. Go Ravens, first place AFC North.
No,
They're not a good team, but they're still first place.
Great, they're fun to watch.
They're fun to watch. So let's talk about jaw pain and what we need to do to help jaw pain in the office. So if we're looking at the anatomy of the jaw pain, we've got the mandible that comes down across like this. And we've got this big muscle, it's kind of like 2 fingers wide, that sits right on top of the jaw. We call that the masseter muscle. Can you tighten that up? Tighten your jaw? Right there. You can feel it right there. That's going to come up across the jawline. And then on top, we've got the temporalis. It's like this big clamshell. That's this really thin muscle that it comes down into here and attaches up top here. So those are the 2 primary muscles that we focus on when doing soft tissue work for the jaw. There's one secret muscle that's called the pterygoid that's on the inside of the jaw that we can also work on too as well, and we'll show you that soon. So we've got the 2 muscles. We've got this one here, we've got this one here, the masseter and the temporalis, the pterygoid, which is on the inside. And then we also want to focus on the joint itself, but also we want to look at the top 2 vertebrae of the neck, because these joints talk to the muscles all through here. And so if we can work on the joints here, we can affect what's happening up here. So we may do some soft tissue work on the suboccipitals, we may do some soft tissue work here and here. We definitely do some soft tissue work on that secret pterygoid muscle. And then we're going to adjust the jaw and the upper cervical. I like this soft tissue technique the best because you can do it at home if you're having jaw pain. So we're going to do it on Anna, and then we're going to teach Anna how to do it so you guys can do it at home. Then we're going to show you that pterygoid release, and we're going to show you some suboccipital stuff, then we're going to adjust the jaw and the neck. So 2 fingers, Anna, 2 fingers. Nails look good.
Thank you.
We're going to come right on the outside of the jaw on both sides, and we're going to take some flat hands, pressure in and then up. So with the mouth closed, pressure in and then up. From here, we're going to have Anna open her mouth as wide as she can. Good, and down. And then we're going to, so we started here at the very bottom. The pressure is on my finger pads here. I'm not poking in like this, like I normally do. I'm going to come here right off the edge, pressure in and up, open. We heard that little pop there. Anna's got some clicking and some gliding, and we're going to show you how we assess that before we adjust her. Pressure in and up, go to open and close. Is that a little uncomfortable, Anna?
Mm-hmm.
Yeah. So you want to have a little bit of pressure on there where it is uncomfortable on the muscle. So I like to do this 3 times a day in 3 sets. So we go 1 here, we go 1 here, and then we go up a little bit higher, and we get on the top part of the masseter. So this is all work on the masseter. Go ahead, open up and close. So I start here, I start here, and I start here. Those are the 3 levels. I'll do that 1, 2, 3, 1, 2, 3, 1, 2, 3, 3 times a day. That's the 3x3 method for stretching the masseter muscle, and it's really effective and something you guys can do at home to help with jaw pain. So Anna, fingertips flat on the bottom of the jaw. We're going to push in and nope. We're going to push in and up, and now you're going to open up and close. Good. Then we're going to go a little bit higher, in and up, open, close. And then we're going to go 1 more up, in and up, open, close. So 3 times a day, 3 sets each time, the 3x3 masseter exercise. So flat fingertips is important. We don't want to poke in. That's the masseter. Now we can do the same technique with the temporalis. But remember, the temporalis is not 2 fingers wide. It's like a big clamshell. It takes up the whole top part of this temporalis muscle, the temporal bone. And so we're going to use all 4 finger pads. We're going to come wide like this, pressure in, and then up, and then open up. Good. And we can go here, here, here on all parts of the muscles. Open, close, open, close, open, close. You guys will feel this when you do this at home. The masseter is pretty thick. I can put some pressure on there and get some tension in there. the temporalis is a very thin muscle, so I don't need a lot of depth or pressure. I really just want to take my fingers here in and pull up, open. Good. Do you feel the difference there, Anna? Mm-hmm. This is an easier stretch on it. You definitely feel this a little bit more, but both are important for working on TMJ pain. I was like, the next thing we're going to do is going to put a quarter in your mouth. No, the next thing we're going to do is going to show you the pterygoid, that secret pterygoid release muscle. So when we're dealing with jaw pain, always want to use a glove if you're a practitioner. It's kind of hard to do this one at home because you need a little bit of leverage, but what we're going to come do here is the pterygoid sits kind of behind the masseter on the inside along the outside of the teeth. So we're going to come along the outside of the teeth, open, don't bite me, close. So I'm on the outside of the teeth and I'm going to go straight back, and then there's that little lip there. You feel that? Mm-hmm. Yeah. So we're going to go, we go straight back along the teeth, and then we curl up and underneath and we apply the pressure that way like that. And then Anna's going to open her mouth. Good, close. Are you wearing mascara? Mm-mm. No. So sometimes if you're wearing mascara and you do this one, it's a little uncomfortable and you can get some, go ahead. Of all the jaw exercises and jaw stretches and soft tissue that we do, this is by far the most uncomfortable. It can be the most uncomfortable because it's often ignored when we're treating TMJ pain. Good. Uncomfortable? Mm-hmm. Yeah. And each time she opens and closes, I'm going to go a little bit deeper and a little bit more pressure as we start to soften that tissue up. Go ahead, open. Good. We want to balance it out. We want to get the other side too, Anna, okay?
All right.
Anna, will you swing around and put your head the other way so we can, I don't have to reach over you?
Yeah.
Good. So scoot towards me, please, a little bit. Good. So open. And I close. Don't bite me, please. This side's a little bit tighter than the other side. Open. Good, close. Just close your eyes, okay? Open. Close. Open. Close. 1 second. Open. Good, right there. Which side was harder for you?
This side, actually.
The other side was harder?
Yeah.
Okay, all right. So those are sort of the two most common muscles everybody works on. An easy stretch for you guys to do at home, and that secret pterygoid that most people ignore when they're treating jaw pain. So that's the soft tissue. We could also do some soft tissue work on the suboccipitals, but you guys have seen that before. We also adjust the suboccipitals, the C1, C2 vertebrae. But today we're going to show you how we adjust the jaw and how we assess the jaw. So Anna, hop on up and have a seat right here for me, please. Good. So we really want Anna to relax in her shoulders and her neck here, please. And I'm going to come in and I'm going to take 2 fingers and I'm going to put them right over the joint line. And I'm going to ask Anna to open wide and close. Open wide and close. And what I'm feeling for is, we call it least and last. What joint opens on either side the least amount, and which one opens last? Go ahead, open again, close. Some other things you may want to look for, is there any deviation when her mouth opens? Does one side look like it's not opening far enough? Open, close. You see how that kind of, when it comes back, it kind of zigzags back in? Do you feel that?
Yeah.
Yeah. So what I feel is, this side here opens least and last, and this side opens more and most. So when I find that, I always want to adjust the stuck side first, and then the other side second. The way we do this is, relax your head back to me, and then come this way a little bit. And what I'm going to do is I'm going to kind of lock out the vertebrae, so it's the motion comes from the jaw and not the neck. A little freebie over there. Slightly open your mouth. And it's just a push motion. It's not a big thrust. Just like that. Open slightly. A little tension on the jaw. And that moved really nice through there. Both of those were really good. So after we've done the soft tissue, after we've adjusted, we always reassess. Open. and close. And look at that, she lost that zigzag right there. Go ahead again, and close. Pretty cool. So we use that. We may combine it with some dry needling on the masseter if it's really tight. We may throw some class 4 laser on there to help speed up the healing tissue. But those right there are the most effective treatments, soft tissue-wise and adjustment for TMJ jaw pain. If you guys have any questions about how we treat jaw pain, leave a comment below. As always, thanks for watching.